my name is Carmen Viner, and this is my head to toe assessment video. So I have my patient here. I've entered the room after I knocked on the door. I've provided hand hygiene, and I have provided privacy for the patient area where I'm going to be performing the assessment. Hello, my name's Carmonique. I'm an LPN, and I'm going to be performing an assessment on you today. It's called the head to toe assessment. Are you okay with me performing this assessment?
Yes.
Okay. How's your day going? Are you doing okay?
Yes.
Okay. Could you please tell me your name and date of birth?
William Viner, 4/22/68.
Okay. Could you please tell me today's date?
August 20th, 2020.
Okay. And one more question. Could you please tell me the current president of the United States?
Trump. Donald Trump.
Okay. Thank you. So I've been assessing the patient's skin tone. The patient looks his stated age. Skin so far is intact with no lesions or moles noted. I'm going to apply my gloves prior to any skin to skin contact with the patient. So first, is it okay if I call you William, or would you like me to address you by a different name?
William's fine.
Okay. So William, I'm going to start with your scalp, and what I'm looking for is any moles or lesions on your scalp. Okay. So nothing was noted in the patient's scalp. There were no lesions, moles, or any open areas noted on the patient's scalp. So I'm going to move down to check your eyes. So I'm going to be doing completing Perla. So can you look at my pen light? Turn it on. Okay. Pupils constrict. Okay. And then also I'm going to be performing the 6 cardinal gazes. So if you could just follow my pen light, William. And I just assess cranial nerve number 1, which is the optic nerve. I'm also going to complete the confrontation test. Could you just look at my finger? Okay, very good, William. And I've just assessed cranial nerves 3, 4, and 6. Next, I'm going to check the patient's nose, which is cranial nerve number 1. I'm just going to start out by inspecting the external portion of the patient's nose. And then I'm going to take my pen light and look inside. Nice, moist, and pink mucous membranes. Noted. I'm going to assess your ears next, which is cranial nerve number 8. Back and down. I'm checking behind the ears, no sores or lesions noted. Just gonna check inside the patient's ears with my pen light. Okay. So now I'm going to check the patient's mouth, and I'm assessing cranial nerves 9 and 10. Could you open your mouth for me? Could you grit your teeth? Can you stick out your tongue? Okay. So I also need to test your gag reflex. So I'm just going to pretend that I'm placing a tongue depressor in the patient's mouth. Okay. And I just need to look inside of your mouth. Mucosa is nice, pink, and moist. Thank you, William. And I just assessed cranial nerves 9. No, I just assessed cranial nerve 9 and 10. Cranial nerves 9 and 10. Okay, so next I'm going to check your neck, your lymph nodes, and your neck. Preocular and postocular. There's no nodules. Do you have any pain or tenderness?
No.
Okay. Can you turn your head from side to side?
Yes.
I'm sorry, your neck from side to side.
Yes.
Thank you. I'm also going to perform the whisper test.
Yes.
Thank you, William. And I also have my Snellen chart, so I did not miss that part during the assessment. So now I'm going to proceed to check your thorax and your lungs. And I have my stethoscope here. Could you breathe in and out for me? Okay. Could you sit up for me just a little bit? I'm assessing the patient's posterior lung sounds. Okay, thank you. Oh, we're not supposed to put this around this. So I'm going to palpate and osculate your carotid. There's no jugular vein distension noted in the neck. Are you feeling okay? Are you comfortable?
Yes.
Okay. to check your pulses. Pulse is nice. Okay. Brachial. Okay. Two. Pulses are strong. I'm not sure if the okay. All right, thank you. So next I'm going to listen to your heart sounds. The stethoscope is placed on the patient's skin, but for video purposes, the stethoscope will appear on top of my husband's shirt. Okay, so I'm going to listen to your aorta. Pulmonic. Are you doing okay?
Mm-hmm.
Herbs point. Tricuspid. Okay. Oh. And then your mitral valve. Mitral valve. Okay. Cover you back up. So I'm going to assess your abdomen. So if I could just remove this pillow and have you lay flat. Are you comfortable?
Mm-hmm.
Okay.
Yes.
Guess I didn't show that in your in the first part. So the abdomen is round, non-tender to touch. Are you feeling any pain?
No.
Okay. I'm gonna listen to your bowel sounds. Okay. The patient's bowel sounds appear to be hypoactive. Okay. Thank you. Would you like the pillow back behind your neck? Okay. And the next part is to move your shoulders internally and externally. Did you want to sit up for that? Or are you okay?
Mhm.
Okay. Okay. All right. In your arms, I need you to do adduction, which is bringing them in, and then abduction, just putting them out. Okay, very good. So we need to assess your flexion and extension. So I need to correct myself. So you're going to move your arms towards you. No, that's flexion and that's flexion. So this way for add. You're bringing them towards you. Yeah. Okay. Thank you. And then for flexion and extension, you're going to do your elbows out and then in. Okay. Thank you very much, William. And then can you move your wrist for me in a circular motion? Okay. And then I'm going to check your hips for internal and external rotation, okay. Thank you. I still have my gloves on, but I'm just gonna take them off because my hands are getting sweaty. But technically, I still have my gloves on. Okay, I'm going to come down and assess your feet. If you could place them in an inverted and exverted position. Okay, thank you. All right, how are you feeling?
Fine.
Okay. All right. So this will conclude my head to toe assessment on Mr. William. I am going to wash my hands, assist the patient in a comfortable position. Are you comfortable?
Yeah.
Do you need anything? Can I get anything for you?
No.
Okay. I've placed the patient's call bell within reach, and that concludes my head to toe assessment. Thank you very much.